welcome to today's deep dive. If you've been tracking the looming antimicrobial resistance crisis, you already know the usual suspects.
Oh, absolutely. The things we constantly hear about.
Right, like the massive research and development funding gaps.
Yeah, or the frustratingly slow pipeline for, new antibiotics.
Exactly. And the heavy reliance on complex genetic engineering just to outpace mutating pathogens.
It's a race we're barely winning.
Yeah. But today, we're looking at a completely different, highly pragmatic weapon. And it's one that just took center stage globally.
It really did.
I mean, one of the most powerful weapons against a massive global health crisis is probably sitting right inside your medicine cabinet right now.
Printed in incredibly tiny text.
Yes, printed in very tiny text.
Yes.
So our mission for today is to unpack a recent January 2026 update from the World Health Organization.
This was regarding the second Global Regulatory Authority Summit on Antimicrobial Resistance, or AMR.
Right. We want to understand how the surprisingly mundane act of labeling is actually being weaponized across the globe to fight drug-resistant superbugs.
It's fascinating.
It is. We're looking at how literally just the text on a box is being positioned as a primary shield for global health.
Yeah, it's a profound shift in strategy. It's moving away from the laboratory and focusing intensely on behavioral economics and regulatory logistics.
Which sounds dry, but it's huge.
Right. And to really set the stage for you, we have to look at the scale of this summit.
It wasn't just a small committee meeting.
No, not at all. This was an assembly of over 200 participants. It took place from the 14th to the 15th of January 2026.
Wow.
Yeah. These were leaders from national and regional regulatory authorities. And what's crucial to understand is that this was not siloed to human medicine.
That's the key part.
Exactly. The gathering explicitly crossed major operational boundaries. It brought together experts in human health, animal health, and the environment.
Along with international organizations and technical partners, right?
Yep. All under one roof.
Okay, let's unpack this. Because when the global health community convenes a summit of that magnitude, I mean, the expectation is usually a demand for billions of dollars in new funding.
Right, a massive financial pledge.
Yeah. But the main takeaway here was that proper regulatory labeling is essentially a low-cost, high-impact tool.
It's highly pragmatic.
It really is. It's an approach that can be rapidly applied in countries all over the world, regardless of their immediate scientific infrastructure.
It relies on optimizing the tools we already have.
Right, rather than just waiting for a miracle drug to be invented.
Precisely. And it addresses a fundamental bottleneck in global health policy.
How so?
Well, if we analyze the opening remarks from the WHO Director General, Dr. Tedros Adhanom Ghebreyesus, he highlighted this critical process of translating politics into practice.
Okay. The gap between what they say and what actually happens.
Exactly. We frequently see politicians and diplomats making grand, sweeping commitments on the global stage, to fight health crises.
Oh, sure. The photo ops.
Right. They draft the treaties, they sign the accords. But as Dr. Tedros emphasized, it's the regulators who actually translate those high-level political promises into real-world enforceable practice.
Because they're the ones writing the rules for what actually goes on the shelf?
Yes. The regulators use the label on the medicine box to force that policy change directly into the hands of the consumer.
Okay, I see the logic in a label acting as a mechanism for policy. But let's be realistic here.
Okay.
We're talking about the specific criteria outlined at the summit. So that's medical indications, exact dosage, potential side effects, specific storage conditions, and instructions for responsible disposal.
Right, the core elements of a label.
It is essentially a comprehensive user manual. But does optimizing the text on a piece of cardboard actually change consumer behavior enough to move the needle on a global crisis like AMR?
What's fascinating here is how directly those specific label components tie back to you, the listener, and to the core mechanics of pathogen resistance.
Okay, walk me through that.
The primary driver of antimicrobial resistance is the misuse of existing drugs.
Right.
So when a patient takes an antibiotic for a viral infection, which it won't cure.
Because it's a virus.
Exactly. Or if they stop a prescribed course prematurely because their symptoms have resolved.
I feel better, I'll save the rest for later.
Right, which is terrible practice. Or even if they store a medication in a humid bathroom where it degrades and loses efficacy, all of those actions create a low-dose environment.
And a low-dose environment is exactly what bacteria need to figure out how to beat the drug.
Exactly. That specific environment allows bacteria to adapt, survive, and learn to resist the medication.
So the label is trying to stop that specific behavior.
Yes. Perfectly clear, unambiguous instructions are the frontline defense to prevent that user-end misuse. It is a targeted behavioral intervention.
Designed to correct the human actions that fuel the rise of superbugs.
Exactly.
That completely reframes the label. It goes from a simple legal requirement to a direct health intervention.
It guides how you use, store, and ultimately discard the product.
But here's where it gets really interesting, because the summit went far beyond the scope of human pharmacies.
Oh, way beyond.
The event was convened by the Quadripartite Joint Secretariat on AMR, and that term, quadripartite, indicates a massive cross-sector alliance.
It reveals that the regulatory focus is expanding to a much wider ecosystem.
Right.
The quadripartite represents a unified, multi-agency front, and the perspectives shared at the summit heavily reflect that broader mandate.
For example,
For instance, the Food and Agriculture Organization of the United Nations, or the FAO, was deeply involved.
okay, agriculture.
Yes. Their Assistant Director General and Chief Veterinarian, Dr. Thanwat Tiensen, spoke about the absolute necessity of strengthening regulatory practices within agri-food systems.
Because we use tons of antibiotics in farming.
Massive amounts. The core argument is that regulating antimicrobial medicines throughout their entire life cycle requires synchronized action across various sectors, because the agri-food system fundamentally impacts everyone.
So we are talking of the regulatory frameworks governing the antibiotics administered to livestock.
Yes, the animals that eventually become the food supply.
But regulating agricultural outputs is notoriously complex.
It's incredibly difficult.
I mean, if a farmer's entire flock is at risk of an infection, is a newly standardized label on a veterinary antibiotic really going to supersede the economic pressure to over-medicate their animals?
That economic friction is exactly why the regulatory authorities from the animal health sector were present.
They know it's a problem.
They do. The Director General of the World Organization for Animal Health, or WOAH, Dr. Emmanuelle Soubiran, reinforced this point.
What was her take?
The strategy is not just about relying on farmer goodwill, it is about tightening the regulatory net.
Making it harder to misuse in the first place.
Yes. She stressed that every time they improve a label mandate, they create a stricter standard that allows inspectors to identify and remove substandard or falsified products from the veterinary and agricultural markets.
So if the label isn't up to the new global code, it gets pulled.
Exactly. Regulating antimicrobials in agriculture is just as critical to preserving the effectiveness of these life-saving drugs as regulating them in human hospitals.
Because it's all connected.
Protecting the integrity of the animal supply chain is a direct measure to protect you from resistant pathogens crossing over.
That makes sense. And that brings up the third piece of this puzzle, which introduces another massive layer of logistical friction.
The environment.
Yes. The summit heavily featured the United Nations Environment Program, or UNEP. Executive Director Inger Andersen introduced the concept of environmental labeling for medicines.
This is such a critical and often overlooked transmission vector.
We are looking at the environmental sector as a major battleground for AMR.
Absolutely. Environmental pollution is formally identified as one of the key drivers of antimicrobial resistance.
Just from manufacturing runoff.
From manufacturing, yes, but more importantly, when these drugs are improperly disposed of by consumers...
Like flushing expired pills down the toilet.
Exactly. Or discarding them in standard landfills. They enter the local water supply and the soil.
And then they interact with whatever bacteria are already living out there.
Yes. Once there, they interact with environmental bacteria. This provides those naturally occurring bacteria the opportunity to develop resistance mechanisms out in the wild.
Which can then eventually cross back into human populations.
Right, through agricultural runoff or contaminated drinking water.
The cyclical transmission vectors between environmental runoff and human pathogens present a massive regulatory challenge.
It's a huge loop that's very hard to close.
So environmental labeling is an attempt to disrupt that specific transmission cycle.
Exactly. As noted at the summit, environmental labeling supports life cycle transparency.
Meaning you know exactly what happens to the drug from the factory to the trash.
Yes. It is designed to empower informed decision-making by the user and promote sustainable disposal practices. If a label explicitly dictates how to safely dispose of a compound so it doesn't contaminate the local watershed, it provides regulators with a mechanism to mitigate that severe environmental impact.
If we pull all these threads together, the behavioral interventions in human medicine, the removal of substandard agricultural inputs, and the mitigation of environmental pollution.
It's a lot.
It creates a highly complex regulatory matrix.
If we connect this to the bigger picture, what we are really analyzing is the operationalization of the One Health approach.
One Health.
Yes. This was the underlying architectural theme of the entire summit.
What does that mean in practice?
The One Health approach is the fundamental recognition that human health, animal health, plant health, and environmental health are intrinsically and inextricably intertwined.
You can't separate them.
You cannot effectively solve antimicrobial resistance in a clinical hospital setting if you are simultaneously ignoring the antibiotic runoff from an industrial farm into a local river system.
Right. It's just whack-a-mole at that point.
Exactly. The consensus among the summit participants was that cross-sectoral collaboration under this One Health framework is absolutely essential if these labeling requirements are going to translate into actual, measurable public health impacts.
The philosophy of the One Health approach is logically sound. I get it.
It makes perfect sense on paper.
But looking at this from a purely logistical standpoint, I have to ask the practical question that surely comes to mind when you consider the reality of consumer packaging.
The physical space.
Yes. How do regulators mandate comprehensive, multilingual, multi-sector One Health instructions onto a tiny 2-inch cardboard medicine box?
It's a real problem.
The physical real estate of the packaging is incredibly limited.
That is the exact point of jurisdictional friction where high-level policy meets physical reality. And the summit participants dedicated significant discussion to these practical hurdles.
They didn't just ignore it.
No, they explicitly acknowledged the severe limitations of pack size. Furthermore, in many global regions, pharmaceutical products frequently cross borders.
All right, so you need multiple languages.
Exactly. A single package might legally require detailed instructions in 3 or 4 different languages just to remain compliant.
Which means the font gets smaller and smaller.
Until it's unreadable. And perhaps the most daunting challenge discussed was the infrastructure gap.
What do you mean?
Even if a regulator successfully mandates perfect disposal instructions on the packaging, there are severe gaps in actual disposal infrastructure across different nations.
Oh, I see.
Mandating a consumer to use a specialized pharmacy biodisposal bin is entirely useless if their municipality lacks that specific infrastructure.
If there's no bin, you can't use the bin.
Exactly.
So the regulators are fighting a multi-front war here against limited space, language barriers, and municipal infrastructure realities.
It's an uphill battle.
But the summit proposed specific design and technological solutions to bypass these roadblocks. It's not just a matter of forcing manufacturers to use microscopic fonts that no one can read.
Thankfully, no.
It requires a fundamental shift in how complex medical information is communicated.
The regulatory focus has shifted toward what the summit defined as context-appropriate communication.
Context appropriate.
Yes. To circumvent the physical space and language barriers, participants highlighted the critical importance of standardizing easily recognizable symbols and pictograms.
Like a universal stop sign, but for medicine.
Precisely. A universally understood visual symbol for "do not flush" or "complete the full course" can instantly convey a mandate that might otherwise require several sentences of text.
Translated into multiple languages.
Exactly. It is about ensuring that the end users can immediately comprehend and apply the behavioral intervention regardless of their native language or baseline health literacy.
That is a clever workaround. You're taking dense regulatory frameworks and distilling them into intuitive visual design.
It's very efficient.
But symbols can only carry a fraction of the necessary data. I mean, there's still a vast amount of critical dosage, contraindication, and environmental data that must be accessible.
You can't put everything into a pictogram.
Right. And that is where the summit turned toward a massive digital shift.
This is where modern technological integration becomes a necessity for global health policy.
What are they proposing?
The summit participants strongly advocated for the rapid adoption of digital tools, specifically e-labeling and the integration of QR codes on packaging.
QR codes. That makes...
By placing a QR code on a physical box, regulators effectively create infinite informational real estate.
You just scan it.
Exactly. A patient or a farmer can scan the product with their smartphone and instantly access comprehensive dynamic dosing instructions.
So it could be tailored to them.
Yes. They could view localized disposal guidelines based on their immediate GPS location or access full multilingual support.
It entirely bypasses the physical constraints of the cardboard packaging.
Completely.
Moving the heavy lifting to a digital space solves the real estate problem. But the summit noted that this digital shift has to be combined with broad public awareness initiatives.
It can't just happen in a vacuum.
Right. A QR code is functionally useless if the public doesn't know they're supposed to scan it.
Or if they lack the underlying awareness of why proper disposal matters in the first place.
Exactly.
Active engagement with consumer groups and civil society is a mandatory component of the strategy.
But to ensure that any of this, the physical labels, the pictograms, or the digital QR codes, is actually implemented by manufacturers, there has to be enforcement.
Yes, the summit highlighted the role of the frontline enforcement actors.
Right. The Secretariat for the Regulatory Agency's Global Network Against AMR, or RAG&A, made a powerful point about this.
They did. They stated that regulators are the true frontline actors in controlling AMR.
Because writing the global rules at a WHO summit is only the first step.
The actual battle is in enforcing those rules consistently across global supply chains.
And how exactly is that enforcement supposed to work on a global scale? Every country operates under its own sovereign government and its own distinct health ministry.
It's highly fragmented.
You cannot simply dictate a universal standard and expect uniform compliance without massive jurisdictional conflicts.
That jurisdictional friction was a major focal point. The conclusion of the summit was that enforcement must be strengthened through rigorous regional regulatory harmonization.
Meaning neighboring countries have to play by the same rules.
Yes, this requires neighboring countries and regional economic blocs to actively align their standards.
So you don't have a weak link in the chain.
Exactly. The goal is that a pharmaceutical or veterinary product manufactured in one country must meet the exact stringent labeling and safety requirements of the country next door to be sold.
That creates a unified front.
When you combine that regional harmonization with active surveillance and rigorous cross-border inspection across the human, animal, and environmental sectors, you really start to see a change.
You weave a regulatory net.
You weave a regulatory net that makes it highly unprofitable and difficult for substandard or non-compliant products to reach the market.
So what does this all mean for you as you navigate your own healthcare?
That's the big question.
If we distill the findings of this massive gathering, it is that the global regulatory authorities left this January summit with a unified, shared understanding of their practical priorities.
They are on the same page.
Right. The Quadripartite Joint Secretariat announced that they will soon be publishing a comprehensive report detailing the actionable steps required to guide this ongoing cross-sector collaboration.
They are actively building a synchronized system.
So the next time you look at a prescription bottle or a small cardboard box of antibiotics, you should view that label differently.
It is not just a dense block of legal compliance text.
No, you are actually looking at a coordinated global defense mechanism engineered across the human, agricultural, and environmental sectors to protect our global infrastructure against the evolving threat of superbugs.
It requires a profound shift in perspective, recognizing the power of precise, localized information as a critical health intervention.
It really is a powerful tool.
But as we analyze the future framework outlined by this summit, this raises an important question, and it is something I want to leave you to ponder.
All right, what is it?
We discuss the incredible logistical potential of e-labeling and QR codes to bypass the physical limitations of packaging.
The infinite real estate.
Right. But if the future of complex, life-saving medical labeling relies heavily on these digital tools to convey dynamic, localized information about dosage and environmental disposal, how will global health authorities ensure this critical data still reaches the populations caught on the wrong side of the digital divide?
Oh, that's a great point.
If a patient or a rural farmer lacks access to a smartphone or reliable internet infrastructure, how do we guarantee they are not entirely left behind by the sophisticated global defense strategy?
That is a vital logistical and structural question to leave on. Thank you so much for joining us for this deep dive. We hope you gain some valuable insight into the mechanics of global health policy, and we will catch you next time.